The following dramatization presents two ill-structured clinical scenarios. It's not intended to model, but rather to promote critical reflection and group discussion on the challenges of advanced planning dialogue. The segment is about a home care nurse named Carrie visiting her patient Julia. Julia has just been told that there is no more curative chemotherapy options to control her advanced cancer. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
I saw Dr. Croft, my oncologist, yesterday.
And what did he say?
Wasn't good news.
Not good news?
No. He says that we've pretty much run out of options. He's not able to give me any more chemo. The liver metastasis is still growing, even with the chemo treatments. He suggested that I should see my family doctor from now on.
Your family doctor is a great physician, Julia. He'll look after you.
I got the impression from Croft that there isn't anything anyone can do to help me anymore.
Don't think like that. That's so negative. You know we'll look after you, no matter what.
Yeah, right. Positive thinking, eh? You're a big help.
So when are you gonna go see him?
Tomorrow.
I'm sure when you talk to him tomorrow, he'll be able to suggest something to help you. How's your pain?
I saw Dr. Croft, my oncologist, yesterday.
And what did he say?
Wasn't good news.
Not good news?
No. He says that we've pretty much run out of options. He can't give me any more chemo. The metastasis is growing in spite of the chemo. He suggested that I should see my family doctor from now on.
This must be a very difficult time for you. How does that make you feel?
Hopeless, abandoned. I don't think there's enough words to describe the way I'm feeling. Dr. Croft has been my doctor for so long. I trusted him. I counted on him. Now he's gone, and I don't know where to go from here.
You know, the cancer cells in your liver can't be cured. But there are a lot of things your family doctor and I can do to help keep you comfortable, you know? Live as normal life as possible.
What could you do to help me?
Well, first of all, I could give your family doctor, Dr. Scott, right? I'll give Dr. Scott a call right away, and I'll set up an appointment for you to see him. And you and I can discuss with him where we'd like to go from here.
Would you come with me? I wouldn't know what to ask him.
Well, we'll see when we can get an appointment, and if I'm not booked, then yes, of course I'll come with you. But in the meanwhile, you and I can talk about what we'd like to ask him. Make a list.
That would help.
I'll be with you every step of the way.
Thanks.
And when I'm done making this appointment, we should talk about the pain you've been having in your arm. You know, I noticed the grip was actually pretty good today.
The transition from curative therapy to a focus on palliative therapy can be traumatic for patients and family. It's a time of profound transition. It's also common to encounter fear of abandonment as patients and families come to realize their situation has become life-limiting. Refocusing and maintaining hope is a key way that providers can help patients cope with the changes they are facing. Through being present in the moment and careful listening, the provider can explore the deeper meaning of what the patient is saying. You have the ability to help uncover fears and concerns about the future and feelings of hopelessness. You also have the ability to support the patient by refocusing hope on realistic goals.